Hello everyone, I'm Dr. Kathy Gaumer. I'm the medical director here at Regain Functional Medicine. I am a board certified OBGYN and I've been board certified for over 30 years. It's hard to believe that that amount of time has gone by, but I've been involved in women's health for that length of time, but now I have the pleasure of taking care of both men and women. So we have an upcoming presentation. I'd like to just preface it a little bit by just talking about hormone therapy and testosterone therapy. A lot of you out there are considering either one of those treatments, and there's a lot of questions, there's a lot of misinformation out there. In this presentation, we'd like to answer some of those questions. Obviously, we can't cover all of them, but during the presentation, we're going to hit on some of the most important points, which is better physiologic health, brain health, and cardiac health. I hope you enjoyed the presentation, and I'll see you on the other side. Now we're going to talk a little bit about functional medicine, which is all about how to get your body healthier on a cellular level. Better physiologic function is what we were used to when we were younger. Better cognitive function was also part of our younger days. And as we get older, those things tend to change. And it's not necessarily our fault. It's just our body's not having what it needs to function and work at its most optimal level. Cardiac disease also seems to worsen with age. So we're going to talk about all three of those different areas individually. The ultimate goal is to make you feel better, make your body function better, and restore your life motion. So let's get started. So usually when I give this presentation in front of a live audience and I start talking to them about hormone replacement therapy or particularly testosterone replacement, usually the audience gets one of two things in their mind. First is usually someone that looks like this, which is kind of the guy that's really pumped up at the gym. He's works out for hours every day, and usually testosterone in this setting is not something that's within normal physiologic levels. These guys are using super physiologic levels and sometimes illegal medications to achieve this type of result. That is not what we do at our office. What we do is try to restore your testosterone levels to a healthy level to allow your body to function better. The second thing that most likely comes into people's minds is increased sex drive. Now, obviously, testosterone replacement in both men and women definitely improves libido and improves sexual function. However, what we're going to talk about today will show you that testosterone and hormone therapy really affects every cell of our body, from our mind and our brain function to our skin and our hair, all of our internal organs, and it's not necessarily just related to sexual functioning. So what are the benefits of testosterone therapy? We're going to go through this in greater detail, but just in looking at this slide, you can see the poor little guy on the left really wants to be the guy on the right. So everything, as we said, from improved brain function and mood, reduced chance of dementia and Alzheimer's disease, reduction in body fat and increasing lean muscle mass, as well as muscle strength, increased bone strength and bone density, and obviously plenty of energy and just a general improved sense of well-being. So let's go through functional medicine and aging. The aging body is increasingly unable to produce needed physiologic levels of hormones, and this inability triggers health decline associated with these negative health markers. So what are these negative health markers? Well, typically in a live audience, I have everybody stand up and I start to go through some of these symptoms, and by the end, and I ask them to sit down if I hit a symptom that they are very familiar with or has happened to them, and typically by the end of the list, everybody's sitting down. So what does that mean? It means that everybody's affected by this. It's not unusual to have these symptoms as we get older. It's a normal part of aging, but we now have ways of improving that and changing it. So let's go through some of the symptoms. Irritability, obviously mood is a big factor and it affects everyone. Fatigue, especially towards 3 or 4 in the afternoon, you're just feeling tired and your brain's dead, you can't function very effectively either at work or at home. This then is worsened by insomnia, either difficulty falling asleep or early waking in the early morning hours and inability to fall back asleep. Forgetfulness, again, brain function, particularly for high-functioning people in very demanding jobs, is typically very stressful. And for them to not be able to have adequate brain function, particularly in the afternoon, it can be very stressful and distressing to them. So hormones can help improve that function and really keep you sharp later in the day. Heart palpitations or just changes to the cardiac health in general becomes increasingly apparent as we get older. If you look at cardiac centers and the cardiac care unit in really any hospital, what you'll find is men in their 40s and 50s and older, and then women typically in their 60s and older. Why is that? Well, we now know that estrogen is cardioprotective, and that's why it takes a little longer for that cardiac risk as women age to catch up to men. Obviously, as we're talking about women, we all know all of the signs and symptoms of menopause: hot flashes, night sweats, mood changes, as we said, vaginal atrophy, which is the changes in thinning of the vaginal tissue, which then can make vaginal intercourse with your partner almost impossible for some women. Obviously, loss of sex drive and loss of libido are a big factor, and not only just for yourself and your own satisfaction, but changes in libido definitely affect your partner and intimate relationships. So what does hormone therapy or testosterone replacement therapy do for the aging body? Optimizing the messenger hormones testosterone and estrogen is health creative and measurable in at least 3 different areas that we're going to address today. For body health, better physiologic function; heart health, better cardiovascular function; and brain health, better cognitive function. So let's talk about better physiological functioning and body health. What does that really mean? Well, hormones can help increase bone density, improved lean muscle mass and muscle strength, improved stamina, especially during your workouts. You have much better energy during your workout, have a much better ability to get through it with continued energy, and typically can continue your workouts and feel better about them rather than feeling incredibly fatigued at the end. You're sleeping better with much deeper sleep, so you feel refreshed in the morning rather than waking up and feeling fatigued at the beginning of the day. There's less body aches and pains. Why is that? Because testosterone actually is an anti-inflammatory. It works to reduce inflammation in the body, which then improves not only muscle strength and bone density, but reducing the aches and pains that go along with weakening of both of those 2 areas. So testosterone also will help provide you with stronger immunity, so you're less susceptible to normal cold or viruses. You have faster recovery, as we stated before, after workouts or just your normal day-to-day activities. So continue with physiologic function. Positive body changes include, as we stated before, increases in lean muscle and reduced body fat, particularly around the midsection, which typically occurs around midlife, both for men and for women. Those changes are normal, but obviously hormone replacement can help reverse those changes. Better physiological performance at the gym, improved workouts, improved stamina, and of course better sexual functioning with improved libido, and discomfort and pain that some women have is greatly improved, and that typically occurs relatively quickly. Increased protein synthesis, and what you eat finally is you're able to see the results. So patients who are dieting who don't have their hormones replaced tend to become very frustrated because whatever they do, they're not seeing the results that they want. They might reduce their calorie intake, they're working out all the time, but they hardly see that the scale budges at all. When we replace those hormones and your body has what it needs to function properly, then you are able to see the results of your hard work, both diet and with exercise. So it does give you motivation to continue doing all of the good things that you've started. So let's talk about cardiac health. What does testosterone and hormone therapy do as far as heart health? Well, we know that there's a better cholesterol metabolism, and that means an improved HDL, which is the good cholesterol, and a reduction in LDL, or bad cholesterol. There also is an improved glucose metabolism, which reduces risk of diabetes, and diabetes and heart disease tend to go hand in hand. So when blood sugars are chronically elevated, it does increase not only the risk of obesity, but it increases the risk of high blood pressure and cardiac disease. Improved vasorelaxation, which means improved elasticity of the blood vessels, which then reduces risk of high blood pressure, which is, as we all know, the silent killer, which a lot of people don't even realize that they have until it's too late. So lastly, let's talk a little bit about brain function. This may not seem as important as cardiac function or heart health, but it actually is probably the most important of all. When we replace testosterone or replace hormone therapy for women and men, we have increased mental stamina, which means that you're able to concentrate at a much higher level. You're able to function mentally at a much higher level. And for a lot of people who are at very stressful jobs that require a lot of intensive thought process and they function at a very high level, this is very important for them. We do know that increased mental clarity allows them to function better at work as well as at home. Their mood is better, they're not as stressed, and they have a much more positive outlook, or what we call general sense of well-being. Everybody that feels better and functions better mentally is going to have a much better mood and outlook on life. So better brain function has been looked at with multiple studies throughout the years. We looked at studies from 1999 through 2005, and this recruited men of all ages from the age of 40 to 80. Over 2,000 men were involved in these studies, and all of them basically came to the same conclusion, which is better cognitive performance was found at an older age when normal testosterone levels were noted at a younger age. So during midlife, the higher the testosterone levels for these men, the better cognitive function that they had when they got older. This is exciting information, and new information is being looked at as far as specifically for Alzheimer's as well. And the testing was done on visual acuity tests as well as general cognitive tests. So any test that was given to these men, the higher the testosterone level, the better the cognitive function as they aged. So functional medicine is actually improving health from the inside out, meaning at the cellular level. So the poor health markers associated with aging can actually be successfully resolved and reversed. Our patients report that they feel better as their hormone levels improve and stabilize. They feel better. They didn't realize how bad they felt, but now they feel so much better. They realize that the hormones have really significantly improved their lives. Their bodies function better physiologically and cognitively, as we've said. Both brain function, cardiac function, and physiologic function improve and stabilize, and they really show significant improvements not only in what they see on their day-to-day lives, but also in the laboratory evaluations. We see those changes at the cellular level. Lab tests consistently demonstrate improved health, and we enable our patients to stay in the game, whether that's work or play or in their personal relationships. You don't nearly need to survive aging. We can actually thrive with aging and improve the way that we can manage our midlife and older age life. We don't have to sit on the sidelines and watch our younger family members enjoy and travel and exercise and do what they want to do. We all want to stay in the game, by whether that's golf or tennis or pickleball, whatever your game is. Traveling, being able to run after your grandkids. We all want to be able to enjoy our lives through midlife and into our older years. Hi, it's Dr. Gaumer again. I just wanted to thank you so much for watching our presentation. Obviously, it probably brought up more questions than it answered, and we can't answer all of your questions in the one presentation. So if you'd like, please come into any of our 4 offices for a consultation or give us a call at the number below. Our motto here at Regain is better. We want to make you better. We want you to feel better. We want your bodies to function better. Thank you again for watching.